Hey guys, this is Bryn with A Mom on the Rocks, and I'm here for our expert interview with Dr. Christine Browning. She's been one of our experts before, and I get the luxury of having her as my professor, which is really exciting. So you should all be super jealous of me. So Dr. Browning, as we talked to her before, she's a professor at Milligan University in the counseling graduate program. And Dr. Browning's focus is primarily on trauma, and then also more recently on some narrative therapy. So talk to us about why those two areas of focus have been of interest to you.
Narrative therapy, narrative care, or narrative focused care therapy is very effective with trauma survivors, and it goes into several areas of study. For example, the brain and how the brain is mapped in a certain way when one experiences trauma in childhood, the different ways it's mapped because of the type of trauma, the length of trauma, etc. And what was the first part of that question? Forgot.
Just why you were drawn to sort of trauma focused as far as your therapy is concerned.
Because it has impacted my life. I had a great deal of trauma history in my childhood, ongoing trauma from the age of 4 till 13 within my home. And then, as is common for trauma survivors, that is often repeated with relationships in teenage years and then early adulthood, and even later adulthood it can be.
Yeah, and so I think
that was my interest.
Yeah, I think it's important to note that for those of us, the reason I invited Dr. Browning back is because I think trauma is something that we often overlook, both with our extreme children and in our own lives, because it's very easy to trivialize what we've gone through and kind of compare traumas, which is sort of ridiculous, but we really do that. So we tend to think of things like sexual abuse, physical abuse, domestic violence, those kinds of things as big T traumas, which we've talked about before. And that certainly is the case. However, many of us have gone through, survived and endured emotional abuse, being relentlessly persecuted verbally at home, that sort of idea of not being good enough. Some of us went without because our parents were constantly working, so maybe we were neglected, or maybe there was some poor parenting skills, and therefore we went without food, or we went without proper care and the things that we needed. And that does kind of play out in our lives. And so today I really wanted to talk about the body's response to that. I've sung your praises in the group about how just even small things you've said in class have kind of alerted me to things I would not have otherwise identified as traumatic for me. But I've not only seen how it's played out in adulthood, but also as a parent. So certain things that I might be extra sensitive to, or might be triggered by, and even as small as like tone of voice or the way someone says something, I might internalize it as something it's not. So I would love to hear, what are some somatic triggers, some things that our body might do in certain scenarios that might allow us to recognize, hey, something isn't right with us right here in this space.
Yeah, it's really important to recognize first that those triggers, the body keeps the score, as Basil van der Kolk says. And so your body is going to respond in ways that it registered trauma at the time it occurred. So a certain tone of voice, as you said, will trigger either a panic reaction or certainly some kind of reaction that's going to put up walls or put the brakes on for you. A certain smell, seeing something, seeing someone, even a certain location might do that, a certain type of car. There are just so many things that can trigger, and I call them triggers, but they will trigger a response in your body. And so the important thing somatically is to start to recognize what is your body doing. So just to slow down enough to, when you get activated, or when you start to feel activated in a certain way, then if you can pause enough to say, okay, what's happening? What's happening within me first? And then what is my body trying to tell me? Because it's not going to lie to you. It's going to tell you the truth. It has housed your memories. Even when you can't remember, it has memories that may then trigger a memory for you. You know, so for example, before I even realized the extent of the trauma I experienced in childhood, I would have body reactions. I would have reactions in my genital area that I didn't understand. And I started to pay attention to those because of the healing I've done through the treatment I've had and the counseling I've had and the work that I've done. And then started to realize, okay, because it would come with memories then, and then just snapshots of memory. So it's important to recognize those triggers. Now, it may be as simple as, and you mentioned the tone of voice. That's a trigger for me because I was constantly belittled, yelled at, and so if anybody raises their voice even a little bit, it sounds like they're screaming.
Yeah.
To me. And pay attention to that. So what is that? What's going on for you? And what do you need to do to self-regulate?
So what are some common things that might happen in our bodies? How might our bodies respond based on different triggers?
Well, one of them is sexually. So you might have feelings in your genital areas, or pains, or stomach pains, or even painful intercourse is sometimes linked to body memory. You might have a tightening in your chest, just an anxiety building, panic attacks. A lot of anxiety related disorders can be your body just saying something is not right with what I'm feeling. You know, I just need to understand it so I can identify where it's coming from.
Certainly.
And then there are ways to, like with anxiety, deep breathing, with the genital arousal, just realizing what that is, and then not punishing yourself for that feeling because your body's reacting. You have no control over that.
Right.
And so just, okay, I know what this is. I know where this is coming from. And that brings some of the anxiety down, just understanding what your body's doing. So like right now, in this season of life, for some reason, I've had it before and I'm having it again for the past maybe 6 months, that I had that Raynaud's phenomenon. So when I get nervous or I'm talking about something that's very close to my story, then my fingers get numb. And that's happening right now because I'm talking about topics that are very close to my story. But that doesn't mean anything's wrong with me. It just means that's how my body is responding at this moment. And they get cold, they get really cold, and they get numb. And I just have to, okay, this is what this is. You know, it's just a reaction of my body to a little bit of uncomfortability. Sometimes if you feel a panic coming on, if you can engage both parts of the brain. So like if you're driving, you have your hand on the wheel. If you do the wheel this way, you know, just do it around your hand that way. That's engaging both hemispheres of the brain, because the right side and the left side. And this kind of takes some deep breaths with it, and it'll calm you down.
Yeah.
It will. So that anytime you can engage both sides of the brain, so crossing your arms and giving yourself a hug, or crossing your legs and just tightening up and feeling that hug for yourself, will help bring that anxiety down a little bit.
Yeah, I like that you kind of likened it sometimes to panic attack symptoms, or the fact that you might have a panic attack. And there's a lot of misdiagnosis here, in that, not that they can't coexist, because they certainly can, but just, I know for me, I get a tightness in my chest. Sometimes I have trouble breathing, or I breathe really fast. My face turns red, and I'm not hot. I just can't control that. My face just flushes. Or I might have rapid heartbeat. I get gastrointestinal issues. That's pretty common. So I've known of people who have had been diagnosed with IBS, and really they just have anxiety or
Right.
some sort of trauma-related response.
Right.
So pay attention to those things that maybe happen more frequently, and you just think, oh, this is just how I am. I was very dismissive of those symptoms that were happening to me quite often. And then I was like, oh, wait a second, something is not okay here. I grew up in a yelling household, not a lot of functional emotions for me except anger. And so my husband doesn't ever raise his voice toward me, but if he gets irritated with our son and begins to raise his voice, then I clam up, and it's like I'm paralyzed.
Yes.
Even if I have nothing to do, I could be in the other room. And I never noticed it until having learned this from you. And it's like, oh goodness, this is very related to why I'm feeling this way.
Yes. And it's great that you say you feel frozen, or you feel like you can't move, because that's that fight, flight, freeze response, and that's what our body's going to do. It's either going to fight, flight, or we just shut down and freeze. And noticing that as well is a good key to you to say, okay, something's going on for me, traumatic response wise. And in all of that recognition, to allow kindness for yourself, to allow yourself to hug yourself, to allow yourself to say, you're not crazy, you're not going insane. Your body is telling you that it has held memory for something that has affected you deeply.
Mm-hmm.
And as you pointed out in the beginning, it's not a comparison game. That's really deadly, because it's your perception of what happened.
Mm-hmm.
And it affected your body with your perception and the way it housed itself in you. And so to allow yourself kindness, which is sometimes the hardest thing for those of us who have experienced trauma, because it feels selfish. It feels like, oh, this is just ridiculous. You know what? I just need to get over this. But no, you need to take time and give yourself room to be appreciated, and appreciate your body for what it's held on your behalf.
Absolutely. And I think it's important. You mentioned just the definition of trauma being the perception of what has happened to you. And I think that's pretty key, because many of us think, well, I can only have like post-traumatic stress disorder if I've suffered or survived a natural disaster or a deadly car accident or something crazy like that. But that isn't the case. My brother and I grew up in the exact same household, and he remembers things very differently than I remember them. And we're almost 3 years difference. I'm older. So I was exposed to things a lot more than he was. And so our memories and the way that our bodies responded and the way we ended up kind of that manifested in adulthood look vastly different. And I think also you mentioned for sexual trauma, having a response of arousal, that's a really important one too, because though I haven't experienced that, I tend to beat myself up and have for decades over a freeze response. I feel like I should have fought back. I should have stood up for myself. Why do I shut down? And I think a lot of people who have experienced physical abuse in any capacity feel that. If they feel arousal, they feel like, well, I shouldn't have felt that way. But our bodies were created to respond in that way. So our bodies are literally doing what they were created to do.
Right.
And so I'm really glad that you brought that up, because I think that's really important. And many of us tend to allow that trauma to maybe prevent us from healing, because it's a continued cycle of abusing ourselves and not forgiving that part of that.
So definitely true. Judith Herman's book on trauma, she's a MD, and she's a writer from probably the late 60s, early 70s. One of the groundbreaking people on trauma and the body in these areas, PTSD, other things. But she says that God created us with the capacity for arousal. I mean, that's the way God created us. So even as a little child, if you are stimulated sexually, you're going to feel pleasure. That's just the way we were designed to be. Out of sync for where it should happen, but you're still going to feel pleasure. And where the problem comes in is that that little child doesn't know what to do with that,
Mm-hmm.
because those feelings it's out of sync with
Right.
their maturity.
Right.
So and if it's a caregiver, which often it is, or a family member,
Mm-hmm.
then it sets up a approach avoid, because you need that caregiver to take care of you, and yet you feel this pain, or your body is saying, this is just not right, something's not
Right.
right about this. Then it's going to set up that come here, get away, come here, get
Right.
away kind of, that you then carry into adulthood and your relationships. And that style of
Right.
relating is all tied into that.
And I think it can really create a tangled web for us about how we incorporate love and trust and sexuality. And
Yeah.
it can get really mixed up.
Yes.
Um, so time goes so fast on these, I can't believe it. But before we have about 10 minutes left, I'd love for you to talk to us about, I know as extreme parents, we're very hypervigilant. That's just a part of our lives. And for many of us, it's to keep our extreme children safe from themselves, or to keep their siblings safe, or even just ourselves if we're in a situation where there's a meltdown occurring. And so as parents, it's very difficult for us to truly rest our bodies, whether that looks like sleep, or whether that looks like time in prayer and devotion, or time in meditation, or time exercising, whatever that looks like for you. Because we can't ever fully turn it off. We feel like we always have to kind of have one eye open and one ear open to make sure we're alert. So if that's the way our bodies have functioned, and we ourselves have our own healing to do, which is very common, what are some things we can do that are practical for ourselves that can start to address some of those somatic responses we're having?
In the area of resting, you're talking
Yes,
about.
because I've noticed recently, especially, there have been several moms, and maybe because Mother's Day was approaching, that have commented like, I feel so guilty, but I'm not even looking forward to this, or I have so many regrets when it comes to this, because I just feel, and I had that same feeling, because it's very overwhelming. There is no, like a lot of moms will joke, I just want to be away from my kids, which may be true, but we might not have that luxury.
Right.
And so what does that look like for us to be able to slow down? And what is the importance of that for our body to just heal from what we have going on?
Yeah. I don't know why this vision comes into my head, but Susanna Wesley, who had 8 children, and John and Charles Wesley were her children, she would often put her apron over her head. And she would, and the kids knew, you just don't talk to mom when she's got her apron over her head. That's just her time for herself. And so she would frequently put her apron over her head, and that was her little world. But I think you touched on it earlier, the permission that we give ourselves to put our apron over our head, figuratively, that you need that time for self-care in order to care for others. And I think there's so much selfishness tied to just taking care of ourselves,
Mm-hmm.
that is really, really unfortunate, because that hypervigilance that you find yourself in is exhausting.
Yeah.
It is just exhausting. Um, there have been times when I couldn't sleep at night, or I woke up like at 2:30, especially when my kids were younger, and there would be a space of about 2:30 to 5:30 that I'd just be awake, and that was my time. That's what it looked like for me at that particular time. Other times it was, as they aged or as things changed, it was when they were in school, or it was, going to your car and just shutting the door for a few minutes, or, just figuratively putting your apron over your head
Yeah.
in
Yeah.
any way you can.
I think that I'm glad you mentioned the guilt portion, because I think the,
I lost you. I lost you there for a minute.
in my back.
Yes.
Okay. I was just saying, I'm glad that you mentioned the guilt part, because I think guilt and shame are very prominent in sort of mom culture right now.
Mhm.
And when you have a child with extra needs, there's that sort of additional layer, because you're oftentimes judged by sometimes people that have no idea what's going on, because they just see you in public and your child's melting down. Or it might be people that should show you love and care, people in your church community, people in your family, your friend group. But when they're not raising children that are neurodiverse, it is very difficult for them to truly understand. And so I think part of what I'm learning is I'm somebody who, because of my trauma, needs to feel in control. And I have diagnosis that kind of make that harder for me. And so sometimes what that means is allowing the people that I do trust, even though that list is quite short, to take some time with my kids. And that might mean that when I come home from class, that I've stayed an extra 2 hours until the library closes to get some things done and to feel like I'm in a space that feels okay. And when I get home, it looks like a natural disaster has occurred in my home, but my kids are alive and they're in bed. And, you know, my husband is like, everything was great. We played a game, or we had a cookout, or, you know, and that's what matters. And sort of allowing myself to prioritize what to let go, because it's impossible for us to do everything. We just can't.
Right. Right.
But that's hard. That's really, really hard.
Yeah, it is hard because even in our culture today, they're super moms, and
Mm-hmm.
which is just a delusion.
Yeah. Oh, for sure.
It's just a delusion because it's your life. You have to, what your kids need, what that requires of you. And and that's also hard for people who've been traumatized, to not want that approval from others and to feel like they're doing good in the world and they get that attaboy or good
Mm-hmm.
job or whatever. Um, it's developing that muscle within yourself that says, I know that what I'm doing with where I am right now is good.
Right.
Today is good. Just deal with today. It's good.
Mm-hmm.
And just giving yourself, being your own best friend, I guess, is a good way to look at it too. That you believe in yourself and the things that you're dealing with, and just look at that and remind yourself, I'm dealing with a lot.
Yeah.
Dealing with a lot.
Yeah. I'm not sure if it was a friend of mine or maybe I read it, but in the last year or so, somebody told me, you know, as it pertains to sort of the negative self-talk and the ways we can kind of shame ourselves, if that's not, if my daughter who's 5, came to me as a mother and said, here's what I'm dealing with, and it's my exact situation, would I respond to her in the way that I respond to myself? And that's really stuck with me, because gosh, no, I would want her to feel heard and I would want her to feel validated. And sometimes our kids drive us insane, and that's okay to admit
Yeah,
that. And
yeah,
I mean, some of my best moments with my parents, and my mom specifically, is when she's been like, oh my goodness, you had such an attitude. And I'm like, yeah, I'm sorry. I was terrible for a while. And just being able to say, oh gosh, I can relate to that now, you know, in the stage where my children are. And so I think that is very true, is being forgiving of ourselves, um, and also recognizing that, one, like we've been talking about today, our body is going to tell us. So if it means seeking help, seeking additional help because you're working through some things, maybe you're getting flashes of memories and you're not able to put those pieces together, that's kind of a key that maybe something's going on. If you're feeling those sort of anxious type symptoms or bodily responses, or if you have those kind of, I think societally we might say, perfectionist tendencies, which I absolutely have those. But those are indicators too that maybe something has gone on. So like, do you have to have everything perfect? Do you have to feel in control all the time? Do you need the praise of others? And not that anything like that is not okay or not okay by itself, but when there's the presence of a lot, it oftentimes is indicative of something other going on outside of that.
right. And so another example would be sometimes when I'm teaching and there's a certain look on a student's face, I'm thinking, oh, what have I done? What have I said wrong? Or what have and then that's just my baggage. That
Mm-hmm.
has nothing to do with the people
Right.
in the class. And then I have to just talk to myself and say, okay, just that's your trauma response. It's okay.
Right.
Even if you blow this lesson, you're still okay.
Right.
You're not going to die.
Right. And I think it's important to think like, and a lot of people in this group have been to therapy themselves or specifically with their kids. And I think it's like, we can look at therapists and say, man, they must have to really check it at the door because they're hearing all of this stuff, trauma, trauma, trauma all day long. How do they deal with their own things? But if you make that relative to your own life, listen, we're moms and many of us partners and friends and daughters and raising children who have all of these extra needs, whether it's just the logistics of like getting medications filled and appointments and all of these things, or if it's dealing with meltdowns and managing sibling, interactions. And if you have a spouse or partner who doesn't really believe in the diagnosis or in medicating, there's so many variables and we're carrying all of that around. It's
Right.
the same. So if we don't take care of ourselves, then sure, our body's going to respond poorly.
Yeah.
I
Yeah.
mean, it's just a matter of time.
Yes, it is. Yeah.
Well,
We
Dr.
we
Browning,
just,
I'm so grateful for you and for your expertise, for your knowledge of trauma and your willingness to take time to share with us. And for those of you who are interested in narrative therapy, certainly look into it. If you have further questions, feel free to let me know and I can ask Dr. Browning for maybe some links. I know that, what's the instructor that you've been studying most often?
the Allender Center,
Allender Center.
Dan Allender. So the allendercenter.org. You can
Perfect.
find book recommendations and
Great.
blogs and different things.
Awesome. Well, thank you so much. I love seeing your beautiful face all the time, and I'm sure I'll talk to you soon.
All right. See ya. Thank
Yeah,
you.
bye.
Bye.